Imagine this. You're taking your birth control pill exactly as prescribed. Everything's under control. At the same time, you've jumped on the weight loss journey with those famous injectable pens, Mounjaro, tirzepatide, or Ozempic, semaglutide. The weight is dropping, the results are showing, but then comes a question almost no one is answering clearly. Can these medications interfere with your birth control? The answer might surprise you. And the consequences could be even more shocking. Let's get straight to the point. Weight loss. Pens can reduce the effectiveness of your birth control. And no, this isn't a social media myth, it's pure pharmacology. Tirzepatide and semaglutide are GLP-1 receptor agonists. They work in the gastrointestinal system by slowing gastric emptying. In simpler terms, they make your stomach take longer to digest food, and that includes your birth control pill. Why does this matter? If the birth control pill takes too long to be absorbed, it might not reach the proper hormone levels in your blood at the right time. What should be a reliable barrier to ovulation becomes a risky game of chance. One clinical study with tirzepatide showed that, during the first 4 weeks of use, hormone levels of ethinyl estradiol and norgestimate dropped significantly in some patients. That means there is a real risk of contraceptive failure, especially during those early cycles, when the body is still adjusting to the medication. And there's more. These pens often cause nausea, vomiting, and diarrhea, side effects that can also interfere with the absorption of oral contraceptives. If you vomit just a few hours after taking the pill, it might not work at all. Now stop and think. How many women today are combining Ozempic or Mounjaro with birth control pills, thinking everything's fine, without knowing this critical detail? It's a dangerous game. But here's where powerful information makes the difference. If you're currently using or planning to start one of these medications, it's time to consider switching your birth control method. Non-oral contraceptives, like the hormonal IUD, subdermal implant, or monthly quarterly injections, are much safer in this context. They don't depend on gastrointestinal absorption, so they're unaffected by what these GLP-1 agonists do in your gut. You don't have to choose between losing weight and staying protected. But you do have to understand how these drugs interact inside your body. That means taking action. Medicine isn't magic, it's science, and science demands well-informed decisions. So, if you or someone you care about is using this combination of GLP-1 weight loss pens and oral birth control, now is the time to act. Talk to your doctor. Reevaluate your birth control method. And don't leave something as important as pregnancy prevention to luck. Your health deserves better than guesswork. Understanding pharmacology means understanding your body, and when you understand it, you take control. If this content made sense to you, hit the like button, share it with someone who needs this info, and subscribe to the channel so you don't miss the next video. We teach pharmacology in a way that's simple, practical, and real, so you can use knowledge to make safer decisions every single day. See you in the next video.